Well, hello, and thank you for joining me today. My guest today is going to speak about two topics that are very, very important for everyone around the world, and that is the importance of sleep and the importance of vitamin D deficiency. Now, often you'll hear about these two topics, but you don't hear about how they interrelate together. So, to speak about how important your sleep and vitamin D is Dr. Stasha Gomenak. Stasha, thank you so much for joining me today.
Thanks so much for inviting me, Steve. It's my pleasure.
I've been following your work for quite a while now, and I just feel that there's nobody talking about these issues in the depth and understanding that you do. Can you tell us how you, as a neurologist, began to start thinking about, the obviously sleep is a part of your clinical practice, but how did you begin to really start to question, how people are getting sleep disorders and what we can really do to fix them?
Well, it was all accidental, but back in like 2004, 2005, one of my daily headache sufferers insisted on having a sleep study. She was young, healthy, no fat neck. She did not look like what we've been told to look for someone who had sleep disorder. And she said, my husband says I snore like a train. I want a sleep study. And I said, I don't think that's relevant. She said, I don't care. We went to sent her for one, and she put on a CPAP device, and her headaches went away. And she'd had daily headache for many years, and none of the medicines I had used had helped her. Well, I had many other patients who looked just like that, young, healthy females, had a couple of kids, nothing else wrong with them, and I was seeing them for daily headache. Well, what if they had a sleep disorder? No one was talking about that, and I didn't know anything about it, and there were no articles about it, so I just started sending a bunch of women to sleep studies. They turned out to not usually have apnea. So that first client had apnea, but most of them just didn't have the normal amount of rapid eye movement sleep. So they had sleep, but not the right phases of sleep. And that led to their other complaints, which was, I can't remember anything, I'm in a bad mood, and I'm tired all the time. And if if you're a clinician and some woman with two kids and a newborn says, I'm tired all the time, I can't remember anything, and I can't sleep, you just look at them funny, like, what do you expect? But in actual fact, if humans were able to have 15 babies and not kill themselves, that means you should be able to have two kids and not feel like you're dying, okay? It's true that it's hard to have an infant and a 2-year-old, but 40 years ago or 50 years ago, it was not uncommon for women to have 4 or 5 babies and survive that. So there's something else going on in the background. It took several years for me to figure things out. So part of it was looking at these sleep studies, thousands of them where the only problem is that they have reduced amounts of deep sleep. Little kids, teenagers, young, healthy people, no one's writing about that. No one has the least bit of an explanation for why. And they can't be treated with a CPAP device because they don't stop breathing. Also, many of the answers of what now is really predominantly in sleep dentistry is about oxygen drops. So the explanation we had supplied was, oh, you're not feeling well because of oxygen drops. But my patients didn't have any drops in oxygen. So you can't answer that by a drop in oxygen. You can only say, oh, I guess we need these phases of deep sleep. Do we do things in there? Well, yeah, we make memories. We do all sorts of important things. Even if we don't know exactly what we're doing, it's a clear clinical observation that if you don't have enough deep sleep, you don't feel good and you're more at risk for other diseases. So at that point, I was using CPAP devices and sleeping pills. And both of them are very frustrating. They're not the whole answer. They don't continue to work over time. And then there was an accidental discovery that one of the patients that I did a sleep study on, this was about 2009, had a sleep study that was 10 solid hours of sleep. She's 18, she looks beautiful, she has daily headache. The medicine actually took her headaches away, but her sleep study shows that she has 10 hours of light sleep. She never once got into deep sleep. She would try to get into deep sleep. Every few minutes, 35 times an hour, she would wake to light sleep. And it looks like she would try to get into deep sleep, and then her brain would wake her. She was not aware that she would wake up. She was just in bed. As far as she was concerned, she lays down, she sleeps, she wakes up, and she feels terrible. And she turned out to have a B12 deficiency, which was the first time that I ever really thought of it in terms of a deficiency state. And I had been reading articles about single cells that run our sleep clock, that fire, that are pacemaker cells. They fire at a certain rate. And there's all this basic science literature about dropping little neurotransmitters, the chemicals that we use to run sleep, on these little cells. And now they fire a little faster, a little slower. And well, that's fascinating. And gee, how is that relevant to clinically what's happening to these patients? There's a second piece to that, which is these cells they're studying also make us paralyzed. Knowing that we must get paralyzed while we're in deep sleep is kind of frightening. That opens all sorts of weird questions like, wouldn't I like drown on my spit if I were paralyzed and I couldn't swallow? So there's an aspect in the background which is I must get perfectly paralyzed, meaning I can roll over in between my paralyzed episodes so I don't hurt parts of my body. I can get paralyzed and come out of being paralyzed. So I do it in little blocks of time. I can get paralyzed enough to repair my mouth, my tongue, all the moving parts of my head, but it doesn't get so paralyzed that I stop breathing. And oh, what if I got a little too paralyzed? Could that lead to sleep apnea? So as I'm reading about these articles in single cells that are the ones that paralyze us, I'm now thinking of it in a totally different way. And then this gal has a B12 deficiency. And then I think, well, I don't know anything about that, but I know we use this chemical to do stuff in the cells. So what if these cells are, wow, what if they were deficient in this stuff? We could give it back and they would start to be normal again and they wouldn't start to goof up. So I'd already had this idea that, oh, apnea or stopping breathing might be too paralyzed. Kicking our legs would be not paralyzed enough. Oh, that's looking at it in a really different way. Instead of saying these are different diseases, instead, they're a single malfunction of a single cell, really, that's supposed to have a certain rate that's perfect, that keeps us perfectly paralyzed. So there are all these other things that were going on in the back of my mind as I was reading the literature that made me think about things in a way that made a vitamin deficiency kind of sensible, in a way it wouldn't have been otherwise.
Stasha, that's so fascinating because, I think, you're kind of tapping into a problem that many, many people experience out there. A, they're not sleeping very well, and B, they're not getting very, very good answers. And then the clinical presentations that, even as you mentioned, dentists are seeing in their patients, the oral presentations of bad sleep. We see the teeth grinders and the people that clearly aren't resting well at night, but aren't necessarily reporting, sleep apnea on their PSGs. I just wanted to get a feel of how this is presenting in your practice. I mean, you're a neurologist, and so what percentage of your patients were, kind of coming in with for these kind of conditions versus other kind of conditions, and where did it start to kind of obviously really, did you start to hone in on this?
Great question. Over time, so at the beginning, I was just doing sleep studies on headache patients. Daily headache sufferers are in a living hell. No one ever can help them. They go from neurologist to neurologist. They'll let you do anything. I mean, they'll do sleep studies. They'll do anything you ask. But soon I began to think, well, wait a minute. I never even thought to ask a daily headache sufferer if they were tired. It wasn't we were never taught to think of sleep as a therapeutic option because there wasn't anything to do. So we wouldn't ask about it. In fact, we were encouraged not to ask about it because the next step would be, yeah, my sleep is terrible. Can you give me some sleeping pills? And we're taught that that's the wrong thing. So I start with that. But soon after that, I know that there are genetic mutations that can lead to daily headache and then progress to vertigo and then progress to epilepsy. Why do they progress? Could it be that this particular gene, as I sleep deprive this person over more and more and more months, their ability to shore up that genetic weakness gets worse and worse. So that these are really, could that mean that my vertigo patients have a sleep disorder? Could that mean my epilepsy patients have a sleep disorder? Why have I never thought in this 18-year-old, I'm about to add a second epilepsy medicine. Do I say, hey, are you sleepy in the morning? Well, no, because I know my drugs are doping them up. It doesn't even occur to me to ask them that. But genetically, they have a channel disorder, and so does the headache patient. Why am I not asking that? Over time, it became clear to me that everyone in my practice, like, it's easier to tell you the things that don't link to a sleep disorder. Like being stung by a scorpion is not about having a sleep disorder. Being shot accidentally in the US by someone with a gun, maybe it has to do with that person that has the gun has a sleep disorder. But every single person who comes in to see a neurologist is malfunctioning in some way. If you step back for a moment and say, you know, there are lots of people out there that never see a doctor. Shouldn't we be concentrating on them? Because they're our model of what perfect life would be. What if they've never had anything wrong with them? What is it that they're doing in their sleep? What is their sleep like? Because it certainly looks like if you take the sleep away from every child, teenager, mom, they present to neurologists or to other physicians with the outcome of not healing correctly in sleep. That becomes then kind of a burden because you become a crazy fanatic. And none of your colleagues really understand what the hell you're talking about. So then you walk into the hospital and you realize, man, these people are really sick. They're like the end stage of we have missed the fact that they have not been sleeping for 30 years. And we've named these diseases and we've developed the drugs for them, but we really didn't do our job, which was to say, oh, the sleep and your lack of that is what led you to have whatever it is you're in here for. So it's now obvious that I'm doing young, healthy people sleep studies during the week. On the weekend, I'm on call and I'm doing sleep studies on stroke patients. They all have sleep disorders. Everybody does.
That's a really interesting point because you're obviously describing symptoms that many people feel. Can you give us a neurologist's view of the types of presentations that you feel these earlier presentations people are presenting with, like the types of headaches? Is it migraines, cluster headaches, or TMJ issues? And what are the end stage diagnoses that are kind of they're eventually getting, just so people can kind of get their head around what the the standard kind of dialogue there is on understanding what is happening with these types of presentations.
Okay, but first let me state that all the diseases I'm going to talk about are all common now. We think it's normal because everybody around us has these things. But if you live before and after this sleep disorders epidemic happened, if you grew up in the 40s, the 50s, or the 60s, where it's true that the drug companies weren't as well developed, but it's also true that the level of depression, suicide, sleep disorders, etc., in teens was totally different. So one of the difficult parts of this is I'm basically going to say every disease around you, everything that everybody's complaining of is related to not sleeping well, which sounds too simplistic. But you have to look at it in a different way and say, are there populations we could actually talk to who don't have these problems at these early ages? All of these diseases are old diseases. They are not brand new on the planet. COVID is part of this bigger picture, but they're not like AIDS where we've never seen it before. These are all old diseases once we go through the list of them. They were old diseases that always showed up as we were dying. So they've all been described in the medical textbooks in the 1800s. What hasn't been attended to is the fact that they've crept up earlier, so that they're happening in 8, 10, 12-year-olds now instead of in 88-year-olds. That makes this a very difficult thing to get your head around. So your question is a good one. If you just stay with sleep disorders, one, people who sleep normally don't know what the hell you're babbling about. They're like, just go to bed. Like, why are you talking about this? No, people who slept normally do not understand this. Frankly, I was starting to have a sleep disorder myself at the time this is happening because I'm perimenopausal and now I'm waking up multiple times a night. You must have a malfunctioning yourself to be listening and to be interested in this problem, because otherwise from the rest of us looking at this person, we've all slept normally, it's just like, well, go lay down and you'll just sleep. Well, once you say that, you realize it's an involuntary state. It is not something you're doing. So sleep disorders, if you want to just stay in that group, actually they're all just different facets of the same problem. I can't fall asleep, I can't stay asleep, I sleep when I'm tired, I sleep from 3 a.m. until noon, and I can't sleep any other schedule. All of those are all about malfunctioning sleep switches. I kick my legs, so my legs hurt in the morning. I act out my dreams. I have sleepwalking. I have night terrors. There are many, many names. And what is a basic truth about medicine is if we don't know anything, we make little categories, and we are very compulsive about saying you have 1 from column A and 2 from column B, and that means you have blah, 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 okay? But if you don't really know why any of this is happening, really you're just making observations, you're categorizing things. When I was reading these pacemaker articles, for the first time, I began to realize, oh, you can really sort this out into 2 things. Some of these are clock problems, and some of them are paralysis problems. If you get too paralyzed, you get apnea. If you don't get paralyzed enough, you move your legs. And then, oh, maybe that's why all these 32-year-olds have knee pain or hip pain or ankle pain. They shouldn't have any pain. So you start with all the sleep disorders that we've named. They all come out of a specific area of the brain stem that runs our sleep. Then you could go to the next, which your question was, what do the other diseases look like? And basically, on the top of the list are all the problems with the immune system not reacting normally and all the autoimmune diseases. Those are so common now that we think it's normal. Then your next category is mood disorders, anxiety, depression, anger. So the next one is heart disease and diabetes and chronic illness. All of these chronic illnesses, we tend to point to, you did it wrong. We used to like to try to vilify people who were smokers. Now they stopped smoking, so we can't blame it on that. We can just say, oh, your lifestyle isn't right. It's really much more complex than that, but it takes looking at sleep as a primary part of healing, that we are self-assembling living beings. We show up on this planet and we are self-sustaining. Before doctors arrive, people live to be 85 years old. That means we weren't messing around. We didn't know their genetics. They just lived to be 85. That's what we should be concentrating on there.
Can you just go through the different ways that a sleep disorder is categorized? So obviously sleep apnea is much more specific for a polysomnograph. What other categories of sleep disorders can people have?
Okay, well, to be truthful, I spend less time talking about this because I find it personally less valuable to me, but you can categorize them as stopping breathing, or you can categorize them as, gee, you don't stop breathing, but you don't get into the right phases of sleep. That really doesn't even have a name because nobody knows what to do about that, okay? So they'll make up names for that and say idiopathic, i.e. we don't know, hypersomnia, I'm too sleepy during the day. So if you don't make certain criteria to make the diagnosis of narcolepsy, then you'll get idiopathic hypersomnia. So you can divide it into, gee, I can't sleep. 2, I sleep but I feel tired. 3, I fall asleep inappropriately during the day. And then you can split it out in more details about I move around during sleep. So I have periodic leg movements of sleep, and we can go into that deeply if you want, but I'm not sure that's very relevant. I really think that the most valuable thing to know is you can get an overnight sleep study that says you do not have significant apnea, but it is not normal, and you will not be told that. You will be told that you had no significant apnea, just that.
And what about people that can't sleep? So insomnia, is that kind of just its own category, or how does that fit
No,
in?
in my belief system, so we haven't gotten to this yet, but what happened after the B12 deficiency was it turns out that all of the people that I'm doing sleep studies on are vitamin D deficient. And once you have a primary thing that's low in all of them, and you find that these goofy, geeky articles about these cells, those same cells that I was just telling you about, that I'm reading about, have vitamin D receptors. And then you're like, what? Why would there be vitamin D receptors? It's supposed to be about bone. No, it links us to the seasons of our planet so we can sleep longer in the winter and survive when there's no food. So once you start thinking about it on a cellular basis, and then maybe this could be a deficiency, and then you get to vitamin D, then you start to say, we started to make sunscreen and air conditioning and computers in the early 80s. And oh, when I was in medical school, there were no courses on chronic fatigue, irritable bowel syndrome, sleep apnea. There were no courses in that because it was not epidemic at that time. You put a timeline together. Within that context, then, not sleeping is just the other side of, okay, I can't sleep. It's just a deficiency state that means that the sleep switches are not able to flip into what is an involuntary state. So if you look at it in a slightly different way and say, well, what is sleep really? If we don't think about it from, I'm a sleep expert, I do overnight sleep studies, and you stop breathing. Okay, we put all that aside for a moment and say, what is sleep anyway? It's a change in state. I'm either awake or I'm asleep. And it is completely involuntary. And we have a time clock. Every one of the cells in our body knows exactly what time it is. We sleep at specific times when that clock is working normally based on our species. We are day hunters. We can't see at night. Owls, they hunt at night, so they sleep during the day. We sleep at night. That means there was always an inherent, well worked out system that was working perfectly in the dinosaurs that put us to sleep at a certain time. And we never once thought about it as long as it was working perfectly. That means insomnia is a malfunction of that same system.
That makes so much sense, and I want to dive into these details a lot more into the second half, because obviously we're really kind of stepping into the area where we're getting a much better understanding of how these issues can pop up. There's just a question pop up here that I thought is a little bit relevant to what we're talking about here. So Danique is describing that I fall asleep in seconds but cannot stay asleep. Can you just describe, like have a little dialogue on what you think may be happening for Danique?
That was the picture of almost all of these young, healthy females who'd had a couple of kids. So their typical complaint was, I'm so tired, I fall asleep easily. Come 3 o'clock, I wake up, and after that, forget it. Okay, at the beginning, maybe I woke up once, I was able to go back to sleep in a half an hour. Now, between 3 and 6, at 5, I just get up because I can't go back to sleep. There are a specific set of chemicals that runs this entire process. You have to think of them as a symphony, just like you would symphonic music. You start with a preamble. There are these cells that are doing this chemical in these ratios for drowsiness, and then we move to sleep, and we flip the switch, and we do that with chemicals, but it's exactly the same. You flip a switch, and now you're asleep. Theoretically, you should never, ever be able to be asleep and awake at the same time. But there are people who are. As soon as you talk about it that way, you can then recognize that's what they're trying to tell you. And there is a specific set of chemicals that leads through the first phases of sleep, where you do light sleep and then you do slow wave sleep. And that's the deep sleep of the first half. And then you wake up and you go to light sleep. You may not wake up to consciousness. There's a different chemical mix that does the second half. So most of these women, in my view, became deficient in acetylcholine for reasons we'll talk about later. But that's just another way to look at, this is a facet of the sleep disorders. And there's an underlying cause and an overarching way of thinking about it that leads to getting this piece back together so that she can stay asleep.
That makes total sense. And so, we're beginning to see, obviously, this is a very broad-standing problem in the community. We're seeing it present in lots of different ways. It's very, very complicated, and we're kind of seeing you in your clinic, trying to work this out. So you said that you began to see some literature connecting vitamin D to some of the switches that were turning this into stages of sleep. What were some of those areas that began to turn your attention to vitamin D? Because I had a very similar basically awakening into vitamin D that kind of pushed me into this whole area too. I'm just interested, what were those first steps in?
So what happened was the gal with the B12 deficiency, I sent her back to her internist to give B12 shots. And it turns out that B12 is all screwed up also. But ultimately, B12 is always secondary to D. The final answer is you never get B12 deficiency unless you've been D deficient a long, long time. And that's not in the literature yet, as far as I know. But that's what turned out to happen. And just by accident, because I was drawing B12 levels, I drew D levels on everyone. And I have their sleep studies. These are all healthy, normal people. They're not on drugs. There's no other reason for them to have an inability to stay asleep, which was the most common complaint. And they all have D deficiency. And just before Christmas in 2009, two guys who were wearing CPAP came in and said, you promised me this CPAP device would make my headaches go away, but it didn't. I've been wearing it for a year, but you sent me that note about the vitamin D the last time I was in here, and you told me to take some vitamin D. And I was like, yeah. And yeah, I started to take the vitamin D, and like 3 weeks later, my sleep is much better. My headaches went away. Two guys told me that in 1 week. So I had been filling out all these lab slips going, take 1,000 IUs of vitamin D. I'm doing it every day. And I'm thinking, this is weird, but I don't care about it. So I don't really think about it until they say, my sleep got better and my headaches went away. And then I went, wow, every single one of these patients has a low D. Could there be a connection? So I go to PubMed and put in vitamin D and sleep, and nothing comes up. But the next entry is vitamin D. So it's really based on the idea that we have search engines now. Vitamin D and the brain. And what I get into is the work of Walter Stump, who's a scientist who's been working in vitamin D and trying to teach us about vitamin D since the late 70s, early 80s, and telling us that it has a context in which this particular hormone that's made by the sun bosses all the other hormones. That means it moves our entire system in relationship to, is there food? Do you want to have a baby when there's no food? Would you like to keep the baby to when the baby's going to have food to eat? What about breast milk? Is that linked? Is my fertility, my metabolism, and my sleep, i.e. hibernation, linked to what the planet is doing? Of course, or we wouldn't be on this planet. We'd just be living at the equator where nothing moves and nothing changes. So there was an article written by Walter back in the 80s that was about these sleep switches that I'm now very familiar with. And he actually studied this particular nerdy nucleus, the nucleus reticularis, pontus, oralis, caudalis. Nobody even knows about that, Why would he even do that? But he's got vitamin D receptors all over it. So I call him up and I say, hey, you don't know me, but I just had this really interesting clinical observation that suggests that D is running sleep. You've written so many articles about D, and you have these amazing articles where you put it in a contextual framework related to the movement of our planet. And you've already written, he's written hundreds of articles about postpartum depression, about fertility, about diabetes, about hundreds of things that have to do with D, in the way he's thinking about it. And I say, what about sleep? Has anybody written about sleep? He says, no, but that's makes perfect sense. That's how we hibernate. Nobody's really thought about it. So Walter and I published an article in 2012 using his scientific observations in the laboratory and my clinical observations. So the next question is not just, is everybody D deficient? Yeah, we know everybody's D deficient. That's not the question. The question is there an ideal D blood level, not a D dose, but a blood level that will then return these poor people's sleep back towards normal? And what would that look like? And that was not that hard to see. All you have to do is say, hey, what's your D level? How's your sleep now? No one had published it. No one had asked anyone. And the biggest problem with D is nobody asks their patients how they feel. We just don't listen to them. We don't say, oh, if you feel better, maybe we should connect that to what your D level is. And we should try to get to a place where you can actually say, here's how I feel and here's what this level is. We don't practice medicine that way. We practice medicine that way for other hormones. Like when you come in and your thyroid's been off and you just change your thyroid dose, the doctor asks you all sorts of things about how you feel. We just haven't made that connection for D. But D is all over the mood. It affects mood dramatically, and it's all over so many other cellular processes that all you have to do is open the possibility that this human being could actually tell you if they feel good or bad. So we published an article saying 60 to 80 was the right level for better sleep.
And makes total sense. For Dr. Komnak, for those of us that aren't as familiar with the brain as you, can you just help us understand what the brainstem is doing? Like this ancient tool we've got that the dinosaurs had to put us to sleep when the planet is dark. What is it actually doing as we go to sleep? Like all these fancy nucleus and receptors. What's the process?
That's a cool question, Steve. That's a really cool question. Okay, I'll try my best. So let's think of it as, for instance, that we have this machine. So we're going to think of it like a machine, because that's what we can make. We can't make living things. We can make machines. But all the machines that we make have maintenance needs, repair needs. They have raw materials they need in order to continue to function. Our body does too. That means every single animal on this planet, whether it's a plant or an animal, has times when it's active, it's growing, it's doing things, and times when it is quieter and actually making repairs, because all of us must make repairs. Our system is 1/3 in sleep, 2/3 awake. And during that 1/3 in sleep, we have to repair everything in our body. So we take for granted that we wake up in the morning, we get out of bed, and everything works. But the only reason why it does is that we actually resupplied all the little energy depots and all the chemicals that we need to make every organ of our body work. If you think about it a little bit differently and think about concentrating on children and growing, they only grow while they're sleeping, while they're paralyzed. Okay, so some of this is pieced together from little bits that we've discovered, and then analogy or deductive reasoning is the rest. But if children only grow in slow wave sleep, so that's the first deep sleep of the night, and usually they have at least 2 hours of deep or slow wave sleep, growth hormone is only secreted in that phase. That hormone then calls out other very specific hormones. So while your kid's arm is growing, that has to mean there's a bone growth hormone, a tendon growth hormone, a lymphatic, an artery, a vein. Every single one of those different tissues is very specific. That means there's a crew that are sitting there growing, putting new cells on, making that arm grow. Who's making sure that the other arm is the same length? Like, who's watching that? Because those guys are busily doing their stuff over here. Who's watching for this side? The brain is. That means every single moment that we open a message that allows a cell to grow, we take a big risk. You open up the genetic material and you let that cell say, I can make 25 of myself. I can make 3,500 of myself. I can open up and reproduce myself and make little blood vessel cells that take over the whole body. Every single time that I let a cell go a little crazy and open itself to making 2, I have to have a supervisor tightly supervising. Oh, he was just about to get crazy and make 10 when we needed 2. Okay, that means that anytime we are not using our body, we are doing very specific things to remodel or grow or repair, and that must be heavily supervised. That means that the brain is probably anatomically organized so that every single piece of your body has a supervisor. Your thumbnail has a supervisor in a specific place. It's always watching and is responsible for the repair of that thumbnail during the night. What we learned 10 years, maybe 15 years ago was if you really do careful experiments of the brain and what's being secreted, once you become an adult and you stop growing, the growth hormone still is only secreted in slow wave sleep. You're not growing, but growth hormone is still secreted, but it's secreted at a certain rate. Now it's not a continuous release, it's a certain frequency. That then means we're really changing from growth to repair. That analogizes to, are we using the same signal to send a signal down to this part of my forearm that used to grow, and now it's sending a signal that says repair? That means that the receptors down here have to be able to tell the difference between a continuous release and an episodic release. That's like mind-boggling. That's a level of complexity that's really amazing. That also means if we just step back for a moment, there are all these other ideas that should occur to you. If my child has a sleep disorder and he wakes up 3 times an hour during slow wave sleep, does that mean he can't grow? Yes, that's exactly what it means. If that means that my brain has to develop and grow and learn things and put down new cells and make new connections every night, and my child is not sleeping normally, not even, let's just say the most mild presentation it could be, that my child is just a little drowsy in the morning and doesn't want to get out of bed. That's basically the whole population. That brain is saying, I didn't get enough time in deep sleep. I'm not ready to get up because I had all these important things to do last night. That means if you cheat your child of deep sleep, their growth and development of their brain, their ability to hit their developmental milestones are horribly affected. And this is tightly bound into increasing autism, ADHD, all the things that we're seeing over the last 40 years that have become epidemic. In a 40-year span, you take that information and then you move it into an adult and say, okay, this adult moved to 25 years old, was completely normal, but now we've taken away their repair phase. What will result from that? And then what you get is any disease that has a genetic background. When you cheat someone of their sleep, they present to their physician with whatever their genetic weaknesses are. So there'll be other people in their family that have XYZ, whatever they have, but they didn't have to manifest that. They actually lived to be 25. In the past, they would have lived to be 75 before they manifested that.
And so the early discussion really ties into that really well, because you're saying, well, this is becoming more and more common, and then you're showing all of these different mechanisms that are dependent, as we grow and develop, on these stages of sleep, hitting these right areas so that we do these correct things. And then, so in your kind of journey in understanding of this, how did you see vitamin D deficiency being the switch as to how this all happens? And can you just describe it in terms of what's happening in the brain?
Describing what's happening in the brain is a little bit tough, but in terms of the practical aspects of, see, sitting in the background, I have all the same explanations that everybody else does. So I'm sitting there with people who can't sleep, who feel awful all the time, and all I'm hearing is you don't do it right, you don't eat right, you don't exercise, there's toxins in your environment, the food is poisoned, and what good can I give to this person? Not the population, but this person who's sitting there in the room with me. Oh, I can't tell them what to do about the toxins. I can, tell them not to use Roundup. But what they want is something right now. And I'm looking at the world as saying like poison, insecticides that everybody else is. And then I get into the B12 and then I get into D and think, wow, the results of a toxic exposure is inability for the cell to repair and do its correct biological mechanisms. But the result of a deficiency state is the same. And if it's a deficiency state, and we can trace it back to when the dermatologist started telling us that it was bad to be in the sun, and since I lived before and after that, I didn't use sunscreen until the 1980s because it didn't happen. And I went out in the sun all the time. And it's only in the last 20 years that pediatricians say you can't put your child out in the sun. So there's a shift in the way you're looking at it to say, oh, I happen to know, because I have a foot in that 1960s as well as now, that things are really different around the world. And if you happen to live in Costa Rica, but you are also smart and you go to college and you're no longer a banana farmer, you are now an executive, you also don't have any vitamin D. So in the first snapshot, it's, oh, cellular function of sleep switches, flipping switches, okay? They're just like the little breakers down in the basement. And then we think, oh, what if they can't flip correctly? And there are hundreds of them, and they're supposed to flip, and they're all missing this chemical that tells them. And oh, by the way, if the D is low, we know that animals are supposed to sleep 3 months, 4 months. We see evidence of that. Then for a second you say, oh, this is happening to everyone. Could it be that this is the answer to all of it? And at the first, I really did think it was going to be the magic answer. And I started giving vitamin D, and everybody got somewhat better, not miraculously better, but definitely could tell the difference. When their D got over 60, they were like, wow, my sleep is better. But unfortunately, by the end of 2 years, everybody was falling apart again. That turns out to be the more important point. Okay, so D does a bunch of things, but the other thing it does, it feeds the microbiome. So the second piece of it is D is a really important part, but the most important thing to remember from this webinar is that D by itself, if you give D by itself and you push the level up, your body will start to run low in a bunch of other things, because there's always two things at play when someone's sick. It's not just D alone. D makes us sleep longer when it's low. That's all. That's what it was meant to do. When the D goes low and you don't have the right bugs, because D feeds the bugs as well, then you just lost an organ of your body. It's like you're walking around without a liver, and they haven't given you a liver transplant. You are walking around, you look like a normal human. This is basically most of the pediatric and most of the adults of the planet at the moment. You look like a normal human, but you don't have an organ of the body, the microbiome. Unfortunately, it's very late that we've learned about it, but for my advantage, all the GI literature is saying these bugs actually talk to the brain. The bugs talk to all sorts of parts of the body. The bugs are in a two-way dialogue, which is unimaginable in the past. That means when the D went low, you lost your sleep and you lost your microbiome. And when you did that, the second really important piece is the microbiome. The bugs run your sleep also. So D is just one piece of a whole array of that symphony. And the bugs supply a lot of the instruments that play in the symphony for the sleep.
I can see maybe, as some papers were starting to be published on this, in the last few years, that you were doing some big jumps in the air with fist pumps, because you'd been thinking about these things for so long. And then the connections between vitamin D and
that was exactly me. That was me, Steve. I was like, yes.
Because it feels like the story that you've been trying to follow has just come out and out and out. It's only really described it well in the last few years. Would you agree? This connection between the gut microbiome.
Last year was the very first article. So since 2009, since Walter's ideas in the 80s, he was theorizing that D was playing a role. He didn't say in the microbiome, because that idea hadn't even occurred to anyone. But he knew it was all about metabolism and the GI tract, because we want to gain weight in the winter and lose it in the summer. So he'd already published those ideas. And then the next thing to happen is I begin to realize that it has to be that this irritable bowel syndrome, and now because I'm interested why all my patients have irritable bowel, it didn't get better with D. That meant that the D going down to the bugs did not bring those guys back. And all of a sudden I'm like, well, it's important that we get them back, because they make B vitamins that make us sleep. There are all these other pieces of it. We had no articles that said D was a trophic factor or a growth supporting factor to the microbiome until 2020. It came out last year, and I was like, oh my God, this is so wonderful. So they actually did it in humans, lowered the D, measured the species that live in the GI tract, and proved that the D is what manages which species occur there.
Okay, and so just to clarify for those that are listening, we're talking about the gut microbiome and the trillions of bacteria that live in the mouth, the digestive system, and the profound connection they have to the immune system, the brain. They release all these different neurotransmitters and all these things that are running through your body. They basically run our body through connection to the environment. It's fascinating, but they're also involved with other vitamins and nutrients, aren't they? So did you find that this connection to the gut microbiome was meaning that vitamin D needed support through other nutrients? What was that connection there?
Yes, that's a really important question. Okay, and since so there are two major areas, and then there'll be hundreds of others that we don't know about. Let me just parenthetically say that the study about D changing the microbiome is not taken from my reference, but instead taken from many articles where they're studying how D affects the little individual bacteria talking to the inside lining of the intestine. What are the interactions there? What are all the chemicals? So there's this really detailed scientific biochemistry of how the immune system talks to the bugs and all the intermediaries. So it was taken out of that literature. And then, so there's still this problem with not being willing to step back and see humans within an evolutionary context, that we're still so humanly focused and so focused on the detail that we're not really willing to say, oh, well, it makes perfect sense that we would survive better if we had our kids in June than if we had them in, when there was no food. Things like that there's a little bit of a disconnect. So having said that, there are now articles that are saying things like, okay, let me say it in a different way. I got to this difficult point where I told you that as I continued with D for 2 years, everybody started to fall apart. So it was clear that the D was maximized. It was still just a really good D level, but everything was failing. And then somebody walked in with a book about a B vitamin, and I went there only as a last resort. I'm like every other physician, trained that vitamins are not important. Nobody cares about them. They're not important, which is bizarre. And so it was really me, against my will, being dragged to a place where I gave this B vitamin called pantothenic acid, that's B5, and it is one of the most overlooked vitamins because somewhere in the past, I can't find the author, somebody started to say there is no pantothenic acid deficiency because it's in every food, and since then, no one's paid any attention to it. And that turns out to be completely wrong. Along the way, and I have other videos that tell the stepwise story of that, it becomes clear that the reason why we have 8 chemicals called B, I know you've never thought about this before, or most people haven't, but why is there a vitamin called A and then 8 called B? That doesn't make any sense. Why do they call them B, C, D, E? And then comes C, okay? It turns out they all came from a bacterial culture that was being grown to make bread and beer. So those 8 chemicals came out of bacteria. They were all originally reported as bacterial growth factors. They're some of the most basic elements to make our biochemical pathways work. So now we know we have 8 Bs, and the next piece should be, well, these Bs don't really come from the food, they come from the bacteria. If you lost your bacteria because your D went low, you just went deficient in 8 Bs as well. So that everybody who comes to my office has a sleep disorder, yes. But what's behind that is they lost 2 things. Their D is low and they lost these bugs. And the B vitamins are a major part of them, but it's a small part. There are now articles from 2019 that took a gal named Francesca Guida in Italy, took D low, so she lowered the D supply to mice, showed that the microbiome of the mouse suffers and certain species die, that those species are the ones that are making the raw materials that become the endocannabinoids. So the endocannabinoid system is a set of chemicals that overlap hormones and neurotransmitters. They are an integral part of a normal nervous system. And when you don't have the bugs, you don't have a normal nervous system. That's a totally different chemical system that has been delayed in the scientific discovery because we vilified marijuana and didn't realize that it was a part of our nervous system, more or less. So those are 2 pivotal parts of how our brain is linked to the chemicals that the bugs are making. That'll just be 2 of hundreds that we don't even know about yet.
And so we started to talk about it's B5, isn't it? That how did you find that connection? Because B5 really isn't talked about.
Nobody talks about it.
No one talks about it, yeah. And the way I kind of started to think about it is that they've got a cream with B5 they put on newborns, and it's like magic. It's like they've got a really bad red rash, and you put the B5 on, and it's like magic. And you look at the literature, and it talks about how it's this barrier function, very similar to vitamin A, and it converts to coenzyme A
Yeah.
in the
And
body.
then it becomes acetylcholine, and then it comes into how it is that kid got the rash in the first place. So the science behind it is well shown in the basic science of what does B5 do? It becomes coenzyme A. What does coenzyme A do? It does 100 different things, but there is an overarching logic. So in the background, one, I would never have gone there except the person brought me a book and said, you're going to want to read this book. And I said, oh, sure. And then put it on the shelf. And it was a book that was about giving pantothenic. It was written in the 90s. It was written by a lay person who had rheumatoid arthritis, who was giving pantothenic acid in large doses to other people with pain. And my patient brought it to me because the author says not only does their pain improve, but their sleep improves. So she made a clinical connection between sleep and this chemical, and she had references. Are you having trouble with the microphone?
It's okay, keep going.
She had references in this book, and the references were about studies that were done in the 1950s that were very peculiar. They were done on convicts. They were very weird things that nobody would do again, but they showed that if you blocked pantothenic acid absorption, you got 4 things in only 2 weeks. So you got sleep disruption, burning in the hands and feet, a funny puppet-like gait, and their bellies hurt them. That literature then emboldened me to say, well, I've just had 2 women come in with burning in their hands and feet, and I don't have a good explanation. And I'm a neurologist. My subspecialty is neuropathy. That is extremely uncommon. And if these 2 people who have nothing in common except that they're seeing me present within a month of each other, that suggests that what I'm doing with this vitamin D is actually pushing their bodies towards a direction of becoming B deficient. And that's without a change in diet. So there's a lot of pieces in between. I would never have gone to that place if she hadn't brought it to me, and if there hadn't been this dramatic change. And again, to understand this, you kind of have to listen to the story of what happened, because it turns out that when you give D, the brain begins to make this enzyme called choline acetyltransferase that makes acetylcholine. Now it's got all this stuff all sitting there waiting. It's waiting for B5 to make coenzyme A so it can use the coenzyme A to make acetylcholine. So someone who's been on D for 2 years or 10 years has a very different response to pantothenic acid dose than a person who's been very deficient. So the patients with rheumatoid arthritis who got there because they were D and microbiome and B5 deficient, you give them 400 milligrams. But when I gave my patients 400 milligrams, they came back and said, were you trying to kill me? This made me agitated and I couldn't sleep. It acted like a drug. That means this has got really important significance in how we function mentally, but it's been treated as though it never happens. That's bizarre. It took me years of going through the literature to put that piece together.
And people often don't talk about this, but acetylcholine doesn't often get described with its role in...
Nobody talks about it because there are no drugs. There are no drugs. Nicotine is the only drug. We have no drugs that mimic acetylcholine. And now everybody doesn't want to talk about nicotine. It's bad. So acetylcholine has been complete. And when I finally got to what does coenzyme A do in the brain? Because the gal who brought me the book, that book was about coenzyme A becomes cortisol. Well, duh, cortisol is all about managing my immune system and not being hyper responsive to immune challenges. So that makes perfect sense. But cortisol doesn't go up in the brain and make you hyper like in 2 minutes, in 5 minutes. This is acting like amphetamine. I mean, that's really bizarre. So one, it took a long time after putting in what does coenzyme A do in the brain, it makes acetylcholine. And then I'm a neurologist. I mean, most people out there in the world, acetylcholine has no significance to them at all. Okay. And it shouldn't. Why would they? But for me, I'm a neurologist and I think, what does acetylcholine do in the brain? Like, there's this big white bubble there that's completely empty. And I thought, that's really weird. Why don't I know? I know it does the neuromuscular junction. It makes our muscles move. We use that model when we first learned pharmacology. Why don't I know what's happening in the brain with acetylcholine? And I begin to go through all the neurotransmitters that I do know. And I realize that every single one of them, it's my experience with using the drugs that do things to them. So I'm in there with a human being who's telling me they used to be depressed and now they're not. And now I'm giving them a serotonin reuptake inhibitor. And I'm learning what these neurotransmitters do because of the drugs I'm using. There are no drugs for acetylcholine except for nicotine. That means that when you actually go into the literature and you go into the scientific literature and you say, what is everybody writing about acetylcholine? And you get into, ADHD and ADD is really an acetylcholine deficiency state in the frontal lobes at the nicotinic level. And you get to the end where the primary scientist is saying, we should really be giving these kids with ADD nicotine. I'm like, that's really going to happen. What are you, crazy? They're going to go smoke a cigarette at recess. No way. But that's what's happening on the basic science side. And then you look at it in a totally different way. You go, oh my God, over this last 40 years, by losing the microbiome and losing the D, we've developed an acetylcholine deficiency state. How would that manifest? Where is it used? And it turns out that rash on the newborn, that's about the acetylcholine anti-inflammatory pathway. Now described only in the last 10 years. Direct connection, brain, vagus nerve, spleen, releases T cells. The T cells release choline acetyltransferase, which then is the enzyme that goes throughout all the tissues and looks for B5 and choline, and then makes this anti-inflammatory chemical that makes your kid not have a rash.
It makes total sense, and when you just go through and follow, I think as a neurologist, obviously following pathways in the brain maybe gives you this kind of logical way of looking at it, but following these pathways, it just makes so much sense, doesn't it? And then the descriptions and the way people are presenting with it. So how did you start to use these can you describe the connection between the vitamin D and the B5 and the B vitamins that you began to use with your patients, and what did you find clinically helped with people that were struggling with their sleep?
That's a really important question, and you have to see this event coming from a complete naivete. Okay, I would never have gone near vitamin D if I knew then what I know now. It's dangerous. It is politically fraught. It's really very difficult. Okay, so I knew nothing about it. So I have this naive question. Hey, could there be a vitamin D blood level that would make our sleep better? The next step is B vitamins. I mean, what's complicated? Well, one, it's 8 chemicals now that I don't know anything about. Okay, so the gal brings me the book. I have this peculiar butt pain. I can't sit down at the end of the day. It's happened in the same time frame that my patients are saying, I just came in here for my headaches and now I ache all over. So I'm beginning to feel responsible for what they are physically experiencing, even if it's something I don't understand. So I'm kind of desperate. Our sleep is crummy again. So I go into the pharmacy and I pick up pantothenic acid and the dose that the gal says in her book, 400 milligrams. I pick that up, and the only thing I remember from medical school is if you give one B, you should get all of them. That is profound. That is 2 sentences that is really profound. It suggests that our knowledge, so if I'm finishing medical school in 1983, there was still a huge part of the biochemistry that was about what the roles that these vitamins play in our biochemistry. And biochemistry is my love. It always has been. So not knowing anything, I'm searching through all the B complexes and realizing this is a mess because they're all different doses. Some have 3B, some have 5, some have all these different doses. How are my patients supposed to make sense of this? And I just go to B100. B100 is 100 milligrams or 100 micrograms of each B. And I only reach for that because I think it can't possibly hurt anybody. And I can tell that they're actually going to get what I tell them to get. Instead of just saying, get a B complex, I want to know what the dose is because I've already learned that vitamin D is really complicated and you can't be sloppy with it. So I'm stepping in now into 8 chemicals where I really don't know what's going on. So I take B100 and I take 400 of pantothenic acid, and for 1 week only, I give it out to about 40 people who come in that week who have a sleep study, a D level, they're starting to feel terrible, and I give them this recommendation. But by the end of the week, I am already noticing that my restless leg syndrome, which is my sleep disorder, is much worse than at the beginning of the week. This is a disaster because this means, again, there are mistakes in the literature. I've just taken something that probably suggests that there's a dose response. I stop the 400 milligrams, I continue on B100, and in a day, my butt pain is gone and I feel great. I'm like, this is another really weird thing. And then I have all these people coming back, so 30 out of 40 of them come back and say, were you trying to kill me with this? I'm like, oh no, this is really bad. There's something unique. There's something different about these people. Taking D for 2 years has changed their biochemistry such that when they take 400 milligrams of pantothenic acid, they get insomnia and get revved up. That is a very complicated, important piece that took years to figure out. Okay, so but that's there as the clinical event. And these people don't know each other. 30 out of 40 people come back and use the same words. In 2 hours, I felt revved up. I only took this for 2 days. I only took it for 1 day. And then a few people come back and say, well, I stopped this 400 milligrams because I thought you're killing me with this, but I continue the B100. And in a day, all my pain went away. And I started to sleep really well. And I was like, oh, that's what happened to me. What do you think is going on with that? I don't know anything about vitamins. I was like, nobody's going to believe anything I say about this. The only person who will ever relate to this is someone else who's just gone through it because it is just too wacky. Okay. It is now. So I published that in 2016, but I've been doing that since about 2014. So we're now 7 years later. It's just as weird as it ever was. I mean, it is so strange to try to explain to someone that you're trying to bring this chemical back. This chemical, if you just type in acetylcholine in the brain, it says acetylcholine is responsible for ability to stay focused, be alert, and calm during the day. And then you flip a switch, and this same chemical determines our ability to enter every phase of sleep and become paralyzed normally. It basically runs everything that's important to us. And why is it important to us? Because we've failed in those areas, okay? The things that have not showed up in the last 40 years, I don't have any answer for why this purple horn is growing out of my forehead. If everybody on your street was saying, oh my God, see that purple spot? You're going to have a horn growing out of your forehead in just a couple of weeks. You'd be running into your doctor saying, get this off of here, okay? I'm growing a third arm out of my butt. No one's going to talk to me. I won't be able to sit down. That sounds totally crazy, but in fact, medicine responds to what walks in the door. They only make medicines for the things that walk in the door. They don't make medicines for a purple horn growing out of your forehead because it's not happening. That means if you look back and say, well, what are all the things that we've just seen happen in epidemic amounts? And then if we put those in these little categories, is acetylcholine linked to any of those? Oh yeah, it's linked to autoimmunity. It's linked to not having an immune system function. It's linked to weird rashes. It's linked all over the place, but it's not really talked about. When I give my lectures now, I say acetylcholine is the most important neurotransmitter of this decade, and it's going to make a huge impact. The piece that's hard is that the medicine is so conservative. Doctors are the most conservative scientists on the planet. I mean, we are just not designed to take and run with some new idea. And I'm not either. I'm just a normal MD. I color inside the lines. I'm not, that independent thinker. But this stuff made a day-night difference in my patients, and we were desperate. There was nothing else. If I had something else, I would have done it because I'm conservative too. But once there is no answer, then we're all willing to go, okay, I'll try this. Vitamins sounds crazy, but hey, it just worked. Then I'm stuck with, I can't stand the idea that everybody's going to laugh at me and think that I'm crazy. I saw this happen. I experienced it myself. Is there scientific literature that explains what we experienced? Absolutely there is. And more of it's filling in every year.
And do you think like your personal experience obviously fueled the way you were kind of, you mentioned this connection with your patients when you were sharing symptoms. There's something about that, isn't it? A practitioner having personal experience is something,
You
and
have to be
having,
doing it. Yeah, you have to have your own struggles with whatever it is. And my sleep isn't perfect now. I put myself on an antidepressant. I threw out antidepressants like they were candy. You have to be experiencing the same shortfalls of medicine to actually see it from the same point of view. Because when I go to my doctor and I tell them all this stuff, and I know they're just going to say I'm nuts or tired or whatever, like, a 32-year-old with the 2 kids, again, she goes into her practitioner and says, blah, blah, blah. And he looks at her like she's crazy because you have 2 kids. What do you expect? No, she knows there's something wrong with her. So you have to live through it yourself to really have compassion for the other people. And to tell you the truth, the only MDs that are really all about this are the ones that have sleep disorders. And they're like sleep specialists themselves, and they run a sleep lab, and they recognize that everything they know, everything they see in their continuing education at their meetings does not answer why they still can't sleep. And they're desperate and they're looking for something else.
and they're interested when you say, "Hey, I took this and I slept better," right? It's
Yeah. Yeah, we're all interested once we get that.
okay. Look, we've kind of gone. There's obviously so much to your work that's it's a little bit overwhelming at points, but I feel we've hit a good kind of overview of the understanding of why you think vitamin D is so important for sleep. You mentioned the levels 60 to 80. What did you find in terms of dosages, and did you always couple that with the B100, which is what was your kind of experience with that?
Thank you for introducing that idea. I have a website, I have a workbook. This is complicated. I wish it weren't. Okay, it's complicated on many levels. The first is just trying to figure out how to get a vitamin D level of 60 to 80. The dose can be anywhere from 400 IUs a day to 40,000 a day. You can never predict what the right dose is going to be for one person. So there's a whole body of misinformation about how to use D. The calling it a vitamin was a dramatic problem. It's not a vitamin, it never was. It's a hormone. That means you have to picture it that way. You have to treat it with great respect. You would never say, Steve, I think that XYZ, you're tired. It's got to be your thyroid. Why don't you just run down the street to the pharmacy and buy yourself some thyroid hormone, and I'll see you back in a year. So lay people even know there's a special mindset for how you treat vitamins. So D by itself is difficult, and there's a lot of complexity, and there's a lot of misinformation that's become front page news from very smart, very well-informed scientists that say things like, oh, I just take 100,000 IUs once a month. It's a fat-soluble vitamin. So they can say it's a hormone 1 second, and 2 sentences later say it's a fat-soluble vitamin. That's a lie. It's not that. It is a hormone. Every hormone in our body stays at this little medium place. Now, because that's already complicated, and more importantly, if you take D by itself and you don't correct your microbiome, you will then push your body into a state where it's trying to make more repairs, but it doesn't have these building blocks, which are the Bs, and then really bad things happen to you. Things that are painful, things that are making other diagnoses where you're going to get on, immune system modulators. So it's not trivial. That means half the world is going to start on D, and then 3, 4, 5 years from now is going to be totally ruined because they did that. So the second piece is, if you step into taking D, you should take B50. So it turns out the B100 that I took and I gave to my patients was a bigger dose, and it worked dramatically well. But not all of us had been taking D for 2 years. So by the time I'm taking that, I'm actually B5 deficient. I've gone through this phase where I'm sleeping better, sleeping better, sleeping better, and now I'm falling apart because my Bs are low. That means I was more deficient than many of the clients who would come in to see me. So now I use B50. D plus B50 together is the growth factors that the bugs need to grow back and be the normal for phyla that we need to be healthy. It's simple. It takes 3 months. It is very simple. It is not about probiotics. It is about providing the growth factors that the bugs need to be the healthy foursome. So this website and the workbook is about instructing you on that this is a bigger picture, that you really do need to learn a little bit in order to be using vitamins safely or hormones safely. And I actually have a workbook that takes you through an entire year. So there's a second question in the background. It's easy for me to describe to you that these are the deficiencies that have resulted from moving indoors. But there's a second question. If I've had an inability to repair my own sleep switches for 20 years, because every time I can't sleep, it's not just my liver or my lungs or my skin that are not repairing. My own mechanism for sleeping is also getting rusty and frayed, and it's not doing it right. That means you're using a broken machine to heal yourself. That's a little more complicated, and that means you first have to step into this with a context of, oh, I haven't been sleeping well for 20 years. That means I have to be kind of patient. I have to give these raw materials, which are the vitamins, and then I have to recognize that sleep itself is the healer. The vitamins are not healing anyone. Sleep is what's healing you. So it's true, you have a little gimpy sleep switches, but they still know what to do. They're designed to fix themselves. They've been doing that forever. You then have to picture this with a little more patience, and you have to picture it as always trying to come towards the center. Okay, my sleep got bad again. What does she say I'm supposed to do now? And now it's a little bit off this way. So there's a path to follow for really a year, year and a half, 2 years, and then an idea set about always trying to make sure that your sleep stays better. And the vitamins are just part of that. There are many other deficiency states that are induced by not having the right microbiome. You become deficient in all these other, like, oh, why do my patients are told by their hematologist they can't absorb iron? They have no answer for that. Here's a 32-year-old man, can't absorb iron. What's up with that? That didn't exist in 1975. So it turns out the microbiome has also been responsible for absorbing all these things that came from our food. It's great that we can measure zinc and copper and iron, but the planet's been doing fine before we learned to measure those. That means there was an organ of the body that made sure that no matter what we ate, that we were able to break down a little bit of this and that and take the zinc out of it and absorb just enough and not too much. That organ was the microbiome. That means many people have other deficiencies in the background that they've developed over that 20 years. That's why there's also a multivitamin as part of this with very specific parameters. So you have to picture this as being, I'm going to dedicate 2 years to putting my body back together by watching my sleep get better over time.
Yeah, I love that idea that sleep is really the kind of vessel, and you kind of have to get yourself there, get your ticket ready, and then you jump on board, and then you go on the healing journey, right? And it's always a journey because these things don't heal overnight. So I really agree with that sentiment that we need to see is this perspective change, that we're going to go on this journey of healing. So Dr. Gomenak, I love your work so much, and thank you so much for spending the time with us today. We're going to have to do this again because you've opened so many cans of worms that I'm personally interested in, but I know that can help a lot of people out there. So we'll definitely plan another session on this. But for those that would like to continue to follow your work more, where can they find you, and what have you got out there that can help people sleep better?
So my website is Dr. Gomenak, and I'm the only Gomenak on the planet. So if you put in something close to that, gomaflogi or whatever, and vitamin D, my site will pop up. So drgomenak.com. I have a workbook there that takes you through. It acts as your personal assistant. It is not the why. The why is what we're talking about now. Okay, the science, the why we're doing this is on the website. It's free. The actual path to follow over a year, where you write your stuff down and you are actually coached into saying, write this down once a week, because you personally are responsible for actually noticing what's going on. So really different than the way medicine has been organized, that you come to the doctor, you say blah, 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 and I give you a pill. No, this is about connecting how your body feels to these changes that we make. That's how you get better. You're in the driver's seat. So I have a workbook. I also have a series of videos that I think are the most important piece of this that we haven't had time to talk about, which is how to use vitamin D and getting your microbiome back to be fertile, because all or nearly all of the infertility that we're seeing in the last 40 years is about a low D. D is directly runs ovulation. It has direct effects on sperm motility and health. And that's all over the OBGYN literature, but the fertility experts choose not to look at it. So running your own fertility, getting a normal pregnancy where your D level is a healthy D level, so that your baby actually goes into a sleep-wake cycle at 30 weeks, because the fetus begins to develop a sleep-wake cycle as part of being in utero. And then you get a baby that sleeps through the night at 3 months. They wake up to feed for the first 3 months, and they start to sleep through at 3 months. We don't even see that happening now. So how to use this program when you're trying to get pregnant, and then how to use this if your babies have already been born, you have children, how to modify this program to work safely in kids who are smaller, and they actually have combined deficiency states. If they were born to a mom who was D deficient and had the wrong microbiome, there are all sorts of developmental stages that have to do with endocannabinoids and other chemistry. It's still pretty much trial and error, but in comparison to what we have to offer, which is, medicines for ADD and, gee, your kid has autism, it's better than those answers.
We're going to schedule that talk very, very soon, because I really believe that those issues are associated with what you're talking about in terms of the influence that vitamin D has throughout the whole body. And, we're just not seeing it. We've just got to change our perspective on these things. So, Dr. Gornak, thank you so much for giving your specialized perspective on this and spending the time with us. It's been so fascinating to hear your story, not only with your patients, but also yourself. And I'm really looking forward to following your work further. Thank you very much.
Thanks for inviting me, Steve. It was my pleasure.